At this time, we are preparing to hear from our keynote speaker, which is none other than Dr. Melissa Rogers. Melissa Rogers serves as Executive Director of the White House Office of Faith-Based and Neighborhood Partnerships. And she knows the Triad region very well, having previously served as former director of the Wake Forest School of Divinity Center for Religion and Public Affairs. So ladies and gentlemen, at this time, will you put your hands together and give a warm Greensboro welcome to our keynote speaker, Dr. Melissa Rogers.
Thank you so much. Good morning. It's wonderful to be back in North Carolina. I want to thank Pastor Pierce for that kind introduction, and also your congregation for making this beautiful space available for us today. It is a true asset that you have deployed for the community's use, and that is a gift to us and collectively to our nation. So we thank you for that. And in particular, I want to thank my old friends Bob Weinberg and Odell Cleveland for inviting me to be here with you, for their friendship and their support of my work, and for their long-standing leadership in this community. They are truly a dynamic duo. Don't you agree? Really, they are a great example of what we can achieve when distinguished leaders from different sectors reach across lines that might have divided us in the past and say, let's work together. When folks like Bob and Odell choose to work together, and all of you, what we achieve together is so much greater than what we could have ever achieved on our own. It becomes greater than the sum of its parts. And so I think that's what we're here today to celebrate, and also to think about how we can move forward and capitalize on these amazing partnerships that you have already established and that you will further establish today. Well, without going much farther, I also want to thank you this morning and bring you greetings from our President, Barack Obama, who I am very privileged and honored to serve. Thank you. President Obama and his administration, we are grateful for the work that you are doing. More specifically, we are grateful for your efforts to find new ways for us to work together to advance the health of our communities. As someone so eloquently said on the video, we all want healthy communities. We all want health for each other. It's part of human dignity. And we all want that for each other. People of all faiths and none. That's what unites us here today, and that's a powerful force. I'm deeply impressed by the ambitious agenda that you've put together. In fact, it's a great sadness for me that I won't be able to stay for the full day, so I've made Bob and Odell promise to give me a full report on the proceedings, because I'm really staggered by the sophistication of your focus and the assets across your community that you've been able to marshal and bring together to find better health for this community, and frankly, to serve as an example for our nation and other communities about what they can do if they follow some of the best practices that you've established. So I'm looking forward to getting that full report. Well, let me just close with a couple of thoughts. First is to say thank you again for the work that you're doing. And thank you for the truly inspiring collaboration that is represented today and that will happen here today. It is incredible to see the kinds of connections that you have forged. You are pioneering a model that, again, we can all learn from. And I want to encourage you to keep going, to keep working at deepening the connections and changing the model by which healthcare is delivered in our country to make it more equitable and more just for all people. What you do in Greensboro will make a difference, not just in Greensboro. It will make a difference in the United States of America. And so we want to thank you for that. I want to say also as I close that our door is always open to you. I hope that those of you who make it to Washington will pay us a visit. I hope that you will connect with our staff at the HHS Center for Faith-Based and Neighborhood Partnerships. And I hope that you will continue to stay in contact by email and other ways, telling us what you've learned and helping us know how we can replicate that model across America. So thank you again for the opportunity to be with you today. Thanks for the work that you do to improve health outcomes, to narrow health disparity gaps, and to develop transformational partnerships with health systems and faith communities and leaders to support and further the common good. Thank you so much.